Bienvenido.
Muchas gracias, Your Highness Princess Dina, distinguished guests and friends from the cancer and NCD community. Since we started this meeting about 2 hours ago, 3,000 people have received a cancer diagnosis around the world. And about 2,000 people have died from cancer in those 2 hours. As you know, cancer is today the second leading cause of death globally. And much more can be done at all levels to better prevent, diagnose earlier, treat people with cancer, and provide palliative care to those who need it. While cancer was once a death sentence, this should no longer be the case. Given what we know, it's actually unacceptable that so many children are still dying unnecessarily from cancer when low-cost and effective treatment strategies are available. It's unacceptable that in spite of the progress made in cervical cancer prevention and control, more than 500,000 women die of it each year, and the vast majority of these deaths are among the most vulnerable populations. It's unacceptable that in 2017, families are still being pushed into financial impoverishment because of a cancer diagnosis. It is unacceptable that that is the reality despite the commitments made by member states in the World Health Assembly and in the UN General Assembly, including the global targets set as part of the 2030 Agenda for Sustainable Development. And these points were reiterated just last month in the WHO Global Conference on NCDs in Montevideo.
Etienne, Krug.
We must act to translate these pledges into concrete actions to save lives, and we must act now. And financial resources should not be an excuse. In May this year, the World Health Assembly endorsed a set of cost-effective best buys and other recommended interventions, of which several are highly relevant to preventing and treating cancer. These include taxing tobacco and alcohol, using campaigns to promote physical activity, vaccinating girls against human papillomavirus, and screening women for cervical cancer. Ensuring these interventions are implemented and improving access to medicines and services should be part of the universal health coverage agenda. All of this needs to happen in partnership among governments, civil society, and international organizations. And therefore, meetings like this one are so important. And WHO is, of course, committed to playing its part in this war on cancer. Supporting countries to implement these best buys I have just mentioned, but also improving the timeliness of diagnosis, the quality of treatment, including through increased access to medicines, diagnostics, surgical services, and radiotherapy, and the strengthening of palliative care services are all among our priorities. WHO is also in the process of developing the tools for costing cancer control programs, organizing dialogues to build health workforce capacity, and has initiated, in partnership with many organizations, several of which in the room, a public health-oriented global report on cancer. I'll have a chance to talk a little bit more about that this afternoon. But I'd like to take this opportunity to thank each and every one of you who've worked hand in hand with WHO over the last months. Together, with directed political momentum, we can transform the landscape of cancer care. I was delighted to see several heads of states and ministers attending this meeting because national political leadership is key. But local leadership at city level is also needed. And we see that cities are crucial hubs of innovation, shaping the way we deal with global health and development issues. This is one of the points Dr. Tedros will highlight in his video message. And at this stage, I actually would like to introduce this message of our Director General, Dr. Tedros, who would have liked to be here very much but couldn't, but has sent us a short message. Thank you very much.
Your Majesty, Queen Letizia, Your Excellency, President Pena, Excellencies, distinguished guests, ladies and gentlemen, my apologies that I cannot be with you in person for this very important meeting. Cancer, as you know, is the cause of 1 in 6 deaths globally. And with rapid urbanization, most cases and deaths now happen in cities, putting a huge burden on health systems that are already straining. Yet, our cities are also uniquely placed to transform the fight against cancer and other NCDs. They're incubators for innovative policies that deliver accessible and affordable care for all and better approaches to prevention. Ultimately, we must invest upfront to fight the preventable causes of cancer. We must support primary care to detect cancers at their earliest stage, when the prospects are best and the costs are least. And we must promote early diagnosis and ensure access to treatment, because prevention is not just better than cure, it's cheaper, and that we all know. The good news is we have more political commitment than ever before for the fight against NCDs. At the recent global conference on NCDs in Uruguay, governments endorsed the Montevideo roadmap and committed to reinvigorate political action and strengthen health systems by making more resources available. But political commitments alone are not enough. We must take action at a national level if we are to halt the rise in cancer and other NCDs globally. For that reason, I have established a new high-level commission on non-communicable diseases to be chaired by His Excellency President Vasquez of Uruguay and Dr. Sania Nishtar of Pakistan that will examine innovative ways to curb the world's biggest causes of death. Working together, we can turn our cities into hubs for cancer prevention and control. They will be the epicenters of change that extend lives for millions of people wherever they live. I wish you every success, and I thank you. Muchas gracias.
Todo lo contrario, gracias a usted. Gracias, Dr. Tedros. And now we kindly ask Francisco Becerra to join us to share a message, please. Francisco Becerra is the Assistant Director of PAHO. Thank you very much for being with us.
Good morning. Thank you very much. Her Royal Highness, Princess Dina Mired of Jordan, Professor Sanchi Aranda, President of UICC, distinguished colleagues, ladies and gentlemen. It is indeed a pleasure and privilege to address you in this World Cancer Leaders Summit. With a warm greeting from our Director and Pan American Health Organization, Dr. Etienne, I wish to thank the government of Mexico for hosting this important meeting, as well as to thank the Union of International Cancer Control for convening a high-level event focusing on how cities can drive change for cancer control. We have just heard from the WHO Director General about the global challenges facing addressing cancer and other NCDs. And I will reflect on our regional challenges and opportunities for cancer control. We all recognize the tremendous toll that cancer has on people, families, and communities. With the sheer number of people affected, it is hampering sustainable development in our countries. Cancer is the second leading cause of death in the Americas, with an estimated 3 million people in our region diagnosed every year. And if we continue with the status quo and not improve our public health policies and strengthen health services, the number of people diagnosed with cancer will increase sustainably by 50% to 4.5 million people by 2030. We know that this is a big challenge in the face of the cancer care gaps in the region and the limited resources available to improve the situation. Problems persist with inadequate public policies to prevent cancer, limited access to cancer screening and early detection, late-stage diagnosis, fragmented cancer care and unequal access to cancer, limited access to palliative care, and far too many people dying needlessly in pain. High cost of care and limited financial protection for cancer patients and families, insufficient cancer care workforce, limited healthcare infrastructure for current and future cancer care needs. But the Americas is making important progress. There are more national cancer control plans. HPV vaccines have been introduced in 23 countries. Ratification of the WHO Framework Convention on Tobacco Control by a majority of countries. Screening of cervical and breast cancer are reportedly available in almost all countries, and population-based cancer registers are being rolled out in the region. New partnerships are emerging, such as with the Network of South American Cancer Institutions and the International Cancer Control Planning Partnership, which are providing external support to member states. However, more investments in cancer prevention, early detection, care, and key policy changes are needed if the cancer burden is to be reduced by 2030. The political commitment for NCDs, which include the recent World Health Assembly resolution on cancer control, as well as the new NCD Montevideo roadmap, present an opportunity to apply the available knowledge and tools to improve cancer prevention and control efforts in the region. In this regard, the Pan American Health Organization will leverage its strategic and technical cooperation with our member states and catalyze the development of cancer plans, cancer registries, and strengthen health systems to increase access to cancer screening, diagnosis, treatment, and palliative care services. We will assist with increasing access to essential cancer medicines through the PAHO Strategic Fund, a pooled procurement mechanism which can help countries obtain low-cost and sustainable supply of high-quality cancer drugs. Not forgetting that we will serve as a partner for the broader cancer control community, promoting universal health coverage and primary health care, strengthening that include the range of services needed for cancer control, as well as the risk or factor reduction policies needed for cancer prevention. But the health sector alone cannot adequately address cancer and other NCDs. So we will continue to engage with sectors beyond health, including education, agriculture, urban planning, environment, and more, to the whole government approach. PAHO will catalyze relationships with the cancer societies and other organized civil society groups, oncologists, and other medical associations, academia, patient groups, and the private sector to improve cancer care in the region. This is where the UICC City Cancer Challenge provides an important new platform for us all to work together and support local communities and cities, working hand in hand with national governments to plan and implement cancer control solutions that meet the needs of their citizens. We are pleased that 2 cities in our region were selected to be part of the City Challenge, Cali and Asunción. And through PAHO country offices, we are collaborating with local officials to ensure the successful implementation of cancer interventions in these cities. As more cities join this challenge, count on PAHO collaboration to be part of this collective movement of partners that can deliver sustainable, robust cancer control solutions in cities. Cancer situation globally is not, if not actions taken, will hinder achieving the Sustainable Development Goals, which, among other targets, aims to reduce premature mortality from cancer and other NCDs by 30% by 2030. So this is our first challenge: how to change the status quo in order to reduce cancer burden, how to work together as to ensure universal access to health and universal health coverage, as to make sure we don't leave anyone behind. I thank you for your attention.